Hi, my name is Justin Ferry, and I'm a Sentara Health Plans member and also a Sentara employee. So back in 2022, me and my wife were expecting our first child, and I had recently changed jobs about 4 months prior. With that comes a little bit of stress. I started to notice some digestive issues here and there. It was probably around the time that my daughter was due that I noticed some blood in my stool, and I thought that was pretty concerning. With family history being there, my grandmother had colon cancer in her older age. I really wanted to make sure that I was doing my due diligence to visit a doctor and get it checked out and see what the next steps would be. When it came to scheduling a doctor and finding a provider that I could work with, it was actually fairly easy. I called the doctor and let them know kind of what I was experiencing and told them that I seemed concerned, and they seemed to be receptive to that. And they did some blood work prior after my initial consultation, and they were able to get me in for a colonoscopy about 2 to 3 weeks later. Leaving the colonoscopy and having my GI doctor tell me, hey, we found some polyps, but that's normal. Nothing looked concerning. I kind of left feeling pretty good. He said, hey, we'll reach out within 4 weeks, and if we don't, then give us a call, we'll give you any further result. The doctor had shared with me that they had to take a little bit of a deeper dive into the results and the polyps, and they had found some cancerous cells were within the polyp itself. The good thing for me was that the cancer cells within my polyp were encapsulated, which basically means that all of the cancer cells were wrapped inside the polyp and nothing had spread to my body. Being 33 years old at the time, just had my first child and starting a family with my wife. There was a lot of fear, a lot of anxiety. I have vivid memories of rocking my 3-month-old to sleep, just crying, uncertain of the future. I definitely believe that there's a common misconception that colonoscopies and colorectal cancer in general is reserved for older age. I know people usually think this can't happen to me, but I'm living proof that it doesn't really matter what age you are, that, circumstances with your health can change. And I think you need to be open to addressing them and making sure you're taking care of yourself and getting checked out as soon as possible. Going through this experience has been eye-opening for me. It's definitely been something that's made me check myself in regards to how I approach my health. I'm a lot more likely to prioritize healthy habits, healthy eating, working out, exercising, things like that can help improve my overall health and not feeling like I'm immune to anything after going through this experience. I just really think it's important for people to speak on their own behalf. You know your body better than anybody does. And so for somebody who may be experiencing symptoms, whether it's related to, digestive issues or other issues, it's very important that, you advocate for yourself when considering your health, because you're the one who knows your body best. My biggest takeaway for me is understanding the priority that your life is and that your health is. You can have advocates for you, but your biggest advocate is going to be yourself.